Excellent. Great. Thank you very much. And look, I appreciate this opportunity to be able to share some of the what I consider really important work that I've been doing. And as I go into it, just a quick background on myself. In addition to being at the Columbia University Medical Center and the New York State Psychiatric Institute, my other day job is I'm a full-time detective in the NYPD. What I like to say is the work and research I do up at Columbia with that hat, literally that hat, if you can see my screen, when I'm wearing that hat, I use it to help inform the law enforcement and first responder work that I'm involved in, which includes in the NYPD being the first ever mental health and wellness coordinator, but also doing some work throughout the country in other countries as well, including Australia, specifically New Zealand and Canada. And before I continue, let me just say, I'm not sure what anyone was expecting for this brief presentation, but one of the key aspects to real resilience is gratitude. And before I continue, let me just express my deep, profound gratitude for Columbia and all the help and support that I've been getting since I've been affiliated with Columbia, specifically John Mann. And words aren't enough, and it's very meaningful to me, and having the opportunity to share that whenever I get the chance. So thank you to John and everyone else. Moving along, so why am I here to talk to you about resilience and the importance specifically within the world of COVID-19 for law enforcement, for first responders, but also the general public? Is a key term to resilience, two key terms: perspective and control. None of us asked for COVID-19, right? That's realizing and coming to terms with there's certain things out of our control, but the perspective aspect is, despite that, we always have control over something ourselves, and we're able to manage our emotions, our actions, behaviors, and the connection of that to our thoughts. And ultimately, nothing changes if nothing changes. And I think, especially talking about law enforcement and everything going on in the world and not sugarcoating anything, we need change. Change is needed, change is necessary. And looking at it briefly right now through the lens of law enforcement, we need to make sure our officers are being able to handle their job and doing it effectively, because we talk about the repercussions and the impact. Within the framework and the research that I've been doing at Columbia, and the background on a specific program that was initially developed for law enforcement and first responders, and it's since been adapted and modified for the general public. It's called Warrior 21. It's a 21-day practice for resilience and mental health. It's been implemented. It is being tested and piloted with different law enforcement members and agencies, as well as in police academies. And the idea here, even just taking a super brief moment to talk about this warrior concept, and again, all about perspective and resilience. Some people have negative connotations about even linking warrior with law enforcement. I'm not here to argue or disagree with that, but for the purpose of resilience, whatever connotation you have of the term warrior, in this resilience program, we talk about taking all those words and descriptions and turning it inward, whether it's a fighter, perseverance, determined, grit, resilience even, it's turning it inwards towards the self. And we remind everybody that participates in this program, including first responders, if your job on a daily basis is to help, protect, and take care of the public, you have to start with yourself. And there's nothing selfish about that. We say that's smart. Again, realizing in the world of COVID-19 that we're all living in and trying to handle and cope with it from the law enforcement first responder perspective, this is one puzzle of the piece, right? There's much more, and it's much more complex. But as changes are being made, as we try to make things even better, we have to make sure in the meantime that the individuals are taking care of themselves, and realizing there's parameters to resilience and even personal resilience. So it starts with the individual, but then it has a ripple effect. When you have the cluster of individuals, it impacts the agency, and specifically in law enforcement and first responders, there's also an impact on the public. And we look at it, what is for the individual, developing their inner strength. The research has shown it helps make people happier, calmer, and more focused. For the agency, why is this so important? The established research has shown that you have better employees when you have those things that I just shared on the previous screen. Also, for example, it helps reduce absenteeism and making mistakes. And when we look at law enforcement and first responders, we can't make mistakes, and we want to reduce the opportunities of that happening. And again, the reality behind it is there's much more, and it's much more complex, but there's also training and other things as well, and rules, regulations, procedures. For the public, again, it's ultimately about safety. If we have more resilient officers, and first responders, that helps increase not only their personal safety, but for their job of keeping the public safety. And where I describe that as the cliche win-win. I mentioned already the concept and the key points of perspective and control. Within resilience, there's 4 pillars, and the way we frame it, the way we share it and promote it: awareness, wellness, purpose, and positivity. Awareness, we talk about having a basic understanding of psychology and the implications that it has. Again, CBT basics of thinking, emotions / feelings, as well as behavior and the impact of that. Also key, and I'll go into this a little bit later, awareness of the breath and breathing practices. Wellness refers to mental and physical health. Purpose, twofold for purpose: having individual goals, but also given the line of work that we're involved in, your purpose, not just trying to achieve personal goals, but a grander purpose. And what is it that you're doing to be successful as an individual must also impact other people in a positive way, which perfectly ties into the next word, positivity. What do we mean? A bunch of things, but 2 I'll share today is realistic optimism, realizing the harder you work, the greater chances of success come back to you, but also realizing it's not guaranteed. The other key aspect to resilience within the framework of positivity is social connectedness, and how important that is, surrounding yourself with like-minded people, but also when you're out of work and surrounding yourself, being able to disconnect. I'm not going to go into the science behind this for the remainder of the presentation, because the science is fairly established. What I'm here to share with you is how we've taken the science and the research and implemented it into practice. But what has the science shown? First of all, the neuroscience behind resilience is fairly deep and complex. Also, just within resilience, as you see on the screen, the impact. So, and again, I want to explain the impact of each of these and the black text on the screen. The research shows there's certain practices that helps build somebody's resilience. We took the established research and figured out how do we make it practical, especially initially for law enforcement and first responders, and now for other practitioners and professionals. But it's the idea of self-efficacy, how important self-compassion is. The breathing, the gratitude, I mentioned the flexibility, because it's not a one-size-fits-all. Absolutely not. It's based on the individual and also the context of the situation, social connections, like I mentioned, and the concept of reframing and cognitive reappraisal. The importance behind that, again, is within the world of COVID-19 and doing this program. It's the idea of, we didn't ask for certain things, but then what do we do with it? How do we look at it? And then it's not just doing the practices. It's not just trying to create habits. It's the science behind how do we get them to stick to ultimately make it part of our lifestyle. The program itself, Warrior 21, it's done all through electronically on mobile devices through Google Classroom. Of course, we modify and adapt it sometimes based on the needs of organizations, but generally speaking, the people sign up. It's a private classroom in Google. What happens is every morning they get an alert for 21 days, Monday to Friday, weekends off. And that alert that they get it for their daily practices, what does it include? First of all, there's a keyword. Every day is structured around a keyword. There's a quote connected to the keyword. 5 minutes of controlled breathing practices. 5 minutes. We try to keep this realistic. 5 minutes of controlled breathing practices. We recommend the following are done as close to or as soon as when the officer, first responder, or anyone else is practicing the program. After you do the breathing practices, there's a short article based on research, but written for the general public on that keyword and the science behind it, and a reflection for how they go about the rest of their day based on that keyword and article. Then every evening, what they get is a little journal, a Warrior 21 journal, or they use their own. Every evening, as closest to when they go to bed, we ask them to do a gratitude practice. Again, all based on hardcore research, data, and science, how important gratitude is, but also importantly, the timing of it. We recommend doing it right before the person goes to bed, because among the many different benefits the research has shown is it helps people sleep. Why is that important? Law enforcement, first responders have a lot of trouble of sleeping. They also are much more prone compared to the general public of different mental health conditions such as alcohol, depression, anxiety, and unfortunately the suicide rates are higher. So again, getting that sleep is important. The gratitude practice. 3 things we ask them to practice every night. One thing that made them happy that day, one thing they did nice for somebody, and one thing somebody did nice for them. Importantly, the aspects behind that is they're not allowed to repeat over the course of the 21 days, because it gets them thinking in the aspect of rewiring the brain, the neuroplasticity. The research is pretty significant. We also talk about perception, how it shapes the reality. So here's some just quick data on it. Much of the work is mixed methods in qualitative, although there's some statistics, very basic descriptive statistics. It's all about perception shapes reality. We want to know from the participants when they completed the program, what's their perception on it? What do they feel about it? What do they think about it? And overall, we asked a recent group that just finished it while they were participating in during the midst of COVID-19. 78% were either very satisfied or satisfied. The remaining amount, by the way, was neutral. The breathing practices, we asked them, well, what did they think about the breathing practices? Combining the very useful and useful, 93% found it. The controlled breathing, though, let's dig a little bit deeper, the qualitative aspect. We want that thick narrative using thematic analysis and other ethnographic data to complement some of the more qualitative numbers that we're still gathering. At the moment, we've had just over, I think, 800 people participate since September from various countries. But here's what one of the people said. The program was helpful and it's something they will continue to use. The breathing helped them overcome their stress while they were in the police academy. The breathing technique they learned was useful in daily life. This is a key thing I just want to mention. This isn't just about being a better cop, being a better first responder, being a better nurse or doctor. We're human beings first and foremost. And these aren't just to be better at whatever their professional life is. It's definitely applicable and carrying over to their personal lives. Gratitude practices, 85% said they found this useful. Again, digging a bit deeper, allowed them to actually think about the things they're thankful for. And as you read that other quote, also the key aspect is you can have, say, for example, a police officer or even a doctor, and for that matter, say, I do plenty of good things every day, which I've heard we tell them, well, let's talk about one. Let's dig a little bit deeper because, again, even some of the work done by Dr. Rick Hansen, he talks about spending just at least 15 seconds thinking about it to create those new neural pathways of enhancing it. And now we ask about specific things here as you look at it on the screen. We're trying to measure, again, basic descriptive statistics, things that are important to help them be better at their work, but also overall in life as well. And I'm pretty happy with some of these preliminary results. One thing I will address is the limitations are that a lot of this is preliminary. It's basic descriptive statistics that we're gathering. There's a heck of a lot more we need to do, but we've got to start somewhere because, again, that non-cliche slide I had up there, if nothing changes, nothing changes. And we all want change and we all need to start doing it. And I'm not talking to any of you, I'm talking to me and the people in my professional life of how we are trying to make those changes. And how you, again, I think you see how these are connected to both their professional and personal life. Again, now specifically, the feedback that we gathered, we never asked specifically about
doing. 2 minutes left, Jim.
Oh, okay. So I'll just do this slide, then I'll open up to any questions. It's the idea of people gave back feedback and data based on COVID-19 and how it specifically helped them. And that last, that you see that quote down there in the black text, especially the uncertainty, this gave them structure. And I'll just stop for a moment. Thanks for letting me know that. Questions, comments, anybody want to share anything? I know I spoke in basically a New York minute. But please, any thoughts or comments while I take a sip of my lukewarm coffee?
So can you give us an idea of how unique or widespread this program is? Are there other police departments around the country doing similar things, or is this a New York specific program?
So great question. So there's various agencies doing various resiliency things. And this is, I'll be the first to say my program is not unique in the sense that a lot of them should sound the same as long as they're based on the same type of science and research, the practices. What's unique to this particular program is the breathing practices, how it's structured, the variations of them, the specific gratitude, but it's the breathing, the gratitude, the cognitive reappraisal, the reframing. And honestly, I'd say a lot of us are still at the infant stage of figuring it out. And we know it's important. We know it needs to be done. We're just trying to figure out the best way to implement it and then trying to get it to stick. And not just in the academy, for example, but throughout the officer's career.
And given the recent social unrest, has there, in your assessment, been more emphasis put on the program, or is there more interest in it, or the opposite?
It's exactly what you just said. It's so much, because regardless of our opinions on what's going on in the world, ultimately, let's talk about what we all connect on. We're human beings. Police officers are human beings. We want police and first responders doing it as best as possible. This is where we're all on the same page. I'd like to think I can speak for everybody. The resilience, and also internally in law enforcement, they know that these skills will help them. It's the idea of how do we do it? How do we do it right? And this is where public police, we are one in that aspect. We need to make sure that these men and women out there on the streets are doing it to the best of their ability, but also don't ever forget, they also go home at night. And better cop, better human, more resilience, better police, better public. And again, it's sure it's not easy. It's not designed to be easy, but the more we do, and again, let me just add that, making sure it's grounded in science and the deep appreciation of not just the hat, but my affiliation, because the help and support that I've gotten, and it's been overwhelming. And personally, I'm pretty happy that there's a lot more to do, but we're doing it and we've started.
So this is a kind of a specific question, but I think a lot of us, well, I'll speak for myself, have been puzzled as to why the police are not wearing masks. And you talked at the beginning about taking care of the individual, and it would seem to me that would be directly related to protecting themselves against the virus. Can you comment on that?
Yeah, so this is Jeff speaking. I'm not speaking on behalf of the police or Columbia. As an individual, having been out there personally, sometimes I took my mask off. Why? It's really hot out sometimes. And when you're walking or running and you wear all that equipment, you got to take it off. Although, and I'm not minimizing it, because we've seen people not wearing it. What I do in my work position is we send out science-based but practically written resilience emails to the entire department. One of them we talk about the benefits of wearing the mask, not just for the others, but for them, and not just their role and for the public. We also appeal to the individual, saying, you don't want to bring it home. You don't want to get your family sick. You don't want to get others sick. And they're human beings like everyone else, Andy. We're much like we're trying to get the public. We're trying to get our fellow cops. Please put your mask on. And I say to you right now, I took it off. I carry mine around. Sometimes I forget. That's why I have about 6 in 4 different pockets. And it is important. And I'm not sugarcoating that. You're right. And it's about the perception shapes reality.
Lily Yamasaki, if you unmute yourself, you can ask a question.
Thank you for the talk. I had heard from a friend of mine that in Sweden, training is 3 years for police. Can you comment on, I think it's 6 months here, right?
Yeah,
how
yes, it is.
a longer training could help establish better neural networks, better habits, better ability to cope with the situation, so that the police are in a better mind frame to be out there in the community with all the stress and strain and uncertainty.
Yeah, so
Can you
it's
just make a comment on the training period?
Absolutely. So, and again, for the short answer, it's an incredibly complex question, but I agree with you. So some of my quick thoughts on it is, if it is 6 months, could it be longer? Should it be longer? It is in other locations. And what do we have now? If it is 6 months, then okay, that's the academy. It's the continuing education throughout their career. And how do we continually remind them, even just looking at resilience? So we had a class that just finished here in the NYPD, and they just finished yesterday. And we're still, okay, they did the 21-day program actually over 6 months. It was every Friday. We know what happens. People will forget. So how do we, as an agency, get it to continually stick throughout their career? And if the academy isn't longer, there's other ways. And again, it's through mobile devices, video learning, in-person learning, couple hours, half a day, full days, because it needs to continue. And no matter how long the academy is, it has to continue throughout their career. And it's not just academy.
We have a couple more questions if people could be very brief, because there's several people want to ask questions. Rita, if you unmute yourself, you can.
Yes, thank you. Jeff, we appreciate your presentation. I didn't know there was this overlap. 2 things. Burnout and the concerns that you're facing is not just a individual effort. So my first question is the resilience included in some structural or systemic aspects of the police department in order to combat these problems. And also, if you call yourself Warrior 21, that establishes a foundation for your being not allies with the public that you're working with. So I'm interested in your comments.
Yeah, and I've heard, we'll start with the second part, the warrior aspect, and we make it very, very clear when we're teaching it, that warrior connotation is very specific of inward. Whatever the connotation is for warrior, then look at whatever positive connotation. Forget about law enforcement, just in general, that warrior spirit. We specifically say turn it inward because on the outward aspect, the police officer is a guardian and protector. 100% absolutely. And again, it's not, the program itself isn't law enforcement specific. It's for everybody. So imagine if you were taking it, reader, for example, it's whatever you connote in a positive way, a warrior, turn it towards yourself. We are very, very careful in any law enforcement setting to differentiate. You're not the warrior mindset on the outside. That's not what we're about. That's old school thinking that we don't subscribe to or share. And we try to be very clear about that. And the other aspect, what I try to emphasize in the very beginning, one of the things we say in the program, and it's not ours, we've heard it, how do you eat the elephant? One bite at a time. And to prevent myself getting overwhelmed, I'm focusing on the personal resilience. That grander systemic paradigm changes needs to occur as well to support the individual to prevent, like you said, burnout. But my focus is on the personal resilience while those greater changes occur and need to be made. I can't bite the whole elephant. And sorry, I'm vegetarian, but I got to come up with a better metaphor.